Welcome to the question and answer webinar on guidelines for yoga posture. This is the final part of our 5-part Yoga for People in Pain webinar series that's been co-sponsored by Pain BC. Today we'll be discussing your experiences and questions about the guidelines for yoga posture practice that we had posted and that you've been practicing this week. My name is Tanya and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability. This webinar is co-sponsored by CIRPD, ourselves, and Pain BC in collaboration with the Canadian Pain Coalition. It's also made possible through the support of the Direct Access Grant through the BC government. As I mentioned, my name is Tanya and I'll be moderating and helping with handling the question and answer session today. And we also have online Lisa Mighton, our education coordinator, and she'll be helping to moderate the questions. And our presenter today is Neil Pearson. Neil is a clinical assistant professor at UBC. He's a board member of Pain BC, founding chair of the Canadian Physiotherapy Pain Science Division, a physiotherapist, a yoga therapist, and creator of the Pain Care Yoga certification. And I'd like to hand it over to him now to do the presentation.
Thank you very much, Tanya, and welcome everyone. We got a bright sunny day here in Penticton, and some amazing questions and comments that we get to talk about today after people have tried this practice. And I must say I'm so pleased to, after reading these, it's obvious that people have been trying these and being mindful and trying to integrate the things we've been talking about. So the way we're going to run today is the way we've been running the other webinar. We'll start with some comments that we've got and some questions that we've received about this sort of gentle yoga practice and the guidelines. And we may have some time at the end to talk more about safety. I know there's a couple questions that have to do with safety with this one, so we'll get to those. And if once we have time for questions, if any of you do have questions about safety or about any research-related things, we can try to tackle those as best as we can. We have a lot of comments and questions, so I'll do my best to move through them. So here we see the two bullets here on the slide. So we'll tackle the first one. The first one says, "This was wonderful. I felt very relaxed. I'm a professional and don't have chronic pain, but I could move to my own tolerance and feel very good doing so. It echoed what I've learned as a facilitator in the chronic pain self-management program from UVic." So yes, this information is very much in line with the other education that we are providing to people who have chronic pain. And a lot of people say sort of similar to what this person has said, is that even though chronic pain is not a big issue, by doing it this way, it can actually feel more relaxing, more calming to practice yoga this way. And certainly using the kinds of guidelines that we talked about here and that you're playing around with, we would hope would be preventative. We don't have any evidence around that, but the big question has been, like, how do we prevent injury from happening in yoga, because it does happen. And really it seems that if we can get people to pay more attention to their body and more attention to their breath and keep things calm, that should help out. And of course that's important for some of the comments we've got here as well today, is how do I make sure that I've got this one injury, how do I make sure that I don't injure something else or injure this problem even more by doing yoga postures? It's really the point of the guidelines. So we move on to the second one. I think that there are signs that they may be helping, but it is not a bad backache that I have, and so the improvement is hard to feel with certainty. So I was thinking when this person wrote this, they're either saying they don't have a backache or they don't have a bad backache. I wasn't quite sure which. But I think the gist of it is that it may not be really easy to tell if you're getting any benefit from it. And so the first sort of step of knowing you've succeeded is that you were able to do the practice without ending up staying worse when you're done. The second thing would be to look at, can you do the practice and actually feel calmer or more relaxed when you're done? That would be great. And for a lot of us, when we first start doing it, we don't feel a big change in the pain right away. The change in the pain that we're going to get from doing this kind of practice will happen once we're actually able to move with more ease, then that decrease in pain and the better movement will follow along. So let's get on to some of the other comments we got. This one's great. The person says, I experienced segmented edges. I had different edges for different body sites within the very same movement. For example, with side twist, my neck hurts. Neck would hurt, yet back would feel better. I find the awareness of calm breathing and relaxed body tension helpful. Needed to monitor these as well as the pain. So if we go to the first point of this is finding these segmented edges, or the idea that it's never so easy. It's just never so easy. One of my students yesterday in class said, well, that's easier said than done, and that's exactly true. Even these guidelines, they sort of attempt to make things a little bit easier, but it's definitely easier said than done when you're in the face of having pain in more than one part of your body, or injury in more than one part of your body. And so it requires even sort of greater attention to be able to pay attention the right way to more than one part of your body. So this person, they did the side twist, the neck hurts but the back felt better, and so we need to say, how do we find the right balance between these two? If you're doing it to try to get your back to feel better, perfect, but we need to modify things so that you don't end up having more pain in your neck. So this person was saying their neck hurt here. It's possible that it hurt worse when they did it, so we definitely want to modify it. Or they may say, I did it, my neck pain really didn't change, but my back felt better. And in that case, we wouldn't need to modify it quite so much. And this idea of needing to monitor these things, the awareness and calm breath, is so important. It takes a lot of practice, and this is one of the big stumbling blocks for people is there's so many things to pay attention to here. We're asking you to pay attention to the movements, but pay attention to your breath, pay attention to your body, pay attention to the pain, and then add on that, paying attention to more than one part of your body, and the tension in more than one part of your body becomes, as you see, more complex, and so it may take more time in that case to get some positive benefit. So next comment says, I really liked the introduction with the reminders and questions for this exercise. This should have been obvious to me. It's so useful as a guide. It also made it clear to me that I actually have some control over changing my pain perception. Never thought of it this way, and this gives me hope. I'm so happy to hear that, because that's one of the big key things that I think is important in pain care. And just as an aside, in this month's Chatelaine magazine, there's an article about chronic pain, and they interviewed me and quite extensively. But one point that they put in there that I said was about this idea about there is hope. We need to do things, find things to get people to understand that even in the face of the horrible nature of pain, we need to find some hope around this. So great! I'm so happy you experienced it and shared that. If we go back to the things, though, the person saying that these guidelines should have been obvious, right? This information should have been obvious, and that's exactly how I felt when I started to understand this better. When I started to, when enough people had told me that this was the kind of thing that worked for them. Because I think some of you would have heard that I said that we didn't get this out of a book. We got this by sort of understanding the way the pain system works, but more so by listening to people who had pain and were succeeding and getting less pain and better function, and they sort of put this together for us. When we sort of got it together, then it seemed like, oh my God, I can't believe we didn't actually understand this before, because it does seem so obvious once you're there. And this other point that the person said here is, it also made it clear to me that I actually have some control, and that's another big part of this, is that I think this is one of the benefits of doing yoga postures, is if we can find a way to do it, find a way to do the physical practice of yoga or any activity that's mindful, and by doing it in the right way, start to realize that we do have more control over the pain and do have more control over our movements. Just that sense of control is a huge thing for many of us when you have chronic pain. And when we start to realize, hey, there actually is something I can control, we know then that sort of goes back into your physiology, and your brain will start to engage the parts of your brain that help you with pain control. So There are 4 parts of our brain, or 4 processes in our brain that we know of that help with pain control, and we know that when you have that sense of control, those parts of your brain will become more accessed. So that's a wonderful positive thing here. So thanks again for that comment. Next one says, I'm really enjoying the part where we're sitting and experiencing the feeling of lightness. When I did this lying down in the past, it sometimes translated into a feeling of tension, whereas doing it sitting up makes me realize I've been slumping in my upper back in an attempt to relax and not to be uptight. Then the feeling of spreading warmth provides further relaxation. So at the end of the practice, with the idea of trying to feel a sense of lightness in your body, it's another breathing technique we can do. And one of the benefits this person, I'm sure, would have had is this once again, this feeling like, wow, you know, I can actually change the way my body feels by thinking about it and by breathing at the same time. And that's, you know, sometimes it takes a while to get there for us when we practice, but when you get there, once again, that gives you more of a sense of control, and that's a really, really key point. Is you know, once we start to do these things, we realize we can change things more than we thought. That really opens the door to us to be able to do more. So thanks again for sharing that one. So I think, Tanya and Lisa, let's see if there's any questions or comments that are coming in.
There's one for this category, and she's saying it's really hard not to catch and hold your breath. She thinks it's because her pain is worse on inhaling, and if you have any suggestions or thoughts on that.
Oh, great. Yeah, there's a couple of different things that we can do with this. First of all, you can change around the way that you're moving and breathing. So whether you breathe in while you're moving, or maybe you breathe in first and then you breathe out as you move, that's another option. So if you do find that it's hard not to have your breath catch and hold it while you breathe in, then what you might want to do is breathe in first, and as you breathe out, then do the movement. And then as you breathe back in again, try to release the movement, and maybe that might soften it up for you to see if that'll work better. The holding of our breath or catching our breath is absolutely a protection response. It's sort of this like an old reflex that we have. Whereas if you move towards something with pain, or if you even think about moving towards something with pain, sometimes we hold our breath. And on top of that, we typically hold our breath when we do something new. And now we know that holding your breath will tend to agitate the system, and I'm sure the person who asked this knows or has experienced that. So we want to try to find a way to diminish that. And so if you're doing your best not to hold your breath, doing your best not to feel like your breath catches, but it keeps on happening, what I would ask you to do is keep on trying. So when you do the movement, really try to go to sort of a soft edge, to a place where there's really not that much increase in pain. If you do that, you'll be more likely to be able to succeed at not holding your breath. And then just keep on doing it over and over, and with enough practice, it's one of those skills that you should be able to get. And once again, this would be one of these places, if you're trying all that stuff and it's still not working, then this is where you really want to try to find some practitioner, a health professional or a yoga therapist who might be able to help you out with other techniques that would help stop this from happening, because it really can be a big stomach bug for a lot of people.
There's one question, I'm not totally sure if it's for this category, but I'm going to try this now. She says, this is Sharon, and she says, I liked this week's practice very much. Is there a way really of taking it further? Is there an online resource for practicing other moves and postures? She says, I've taken yoga before I had chronic pain, and those sorts of classes aren't suitable for me at this time.
Yeah, that's a great question, Sharon. And right now we don't have those resources. We're actually, as we've been going through this and seeing that there's so much interest in this sort of thing, wondering, you know, how can we take it further? Can we find a way to get the resources to be able to take that further here? The only thing that I know of that's out there right now would be things that you do have to pay for. First of all, you know, yoga DVDs aren't all that expensive, and now that there are some sites on the internet where you can download them, which makes them even less. But what you'd really be looking for is something where it's really gentle. And I wish I could tell you that all of the gentle yoga DVDs are really gentle, but they're not all really all that gentle. But that would be the place to try to go, is look for other resources like that. If you think Tai Chi would be something that would suit you, or if you think something like Qigong would help you, there are also DVDs out there where you can do those movements. They're often very, very gentle movements, especially in Tai Chi. So that's all I can think to offer you at this point.
That's all the questions at this moment.
Okay, well, let's carry on. I think there's actually a question further a little bit about that. But so these next two, we'll go with the first one. It says, would like to know if there are kinds of pain in which yoga postures are not able to help. Definitely, there's going to be some kinds of pain. You know, for people who have pain from cancer or other neurological injuries, it's going to be hard for these to help. I think you probably can imagine if someone's had a stroke and they have a pain from the stroke, the yoga postures are going to maybe not be as beneficial, and this person would definitely need some guidance with it if that was the case. But I know there's got to be, because I don't like, absolutes don't seem to make a lot of sense, so there's got to be some pain conditions in which it won't help. I think there are definitely some pain conditions in which there's going to it will require a lot of modification and a lot of one-on-one work. I'm thinking of the patients that I have who have complex regional pain syndrome, or people who might have pain from an injury of their central nervous system. I think it's going to be much harder to find a way to do yoga postures for these things without the postures making actual postures seeming to increase the pain, so we need to do a lot of modifications. So the yoga postures are there to help with the pain from so many different aspects. Typically we think we have pain so we get stiff, and if I could just be more flexible I'd have less pain, and that may be the case. Or we have pain and we get less active, and so we lose strength, and we think if I could just be stronger I'd have less pain. And there's definitely some research that says that when people start getting stronger in the face of chronic pain, that their pain typically gets better too. So there's very physical things, but because doing yoga postures, because moving your body affects more than just the physical you, it affects the sort of mental and emotional and spiritual you, there are benefits that we get from what happens there. If you are doing the yoga posture and you can finally feel some sense of control, you can get some benefit in terms of pretty much any kind of pain from that. If you're doing the yoga posture and you're feeling stronger again, not just that your body feels stronger, but your sense of yourself is that you have more strength and more vitality, that typically those things typically help with going into the pain. Or if it makes you less anxious, or makes you feel happier, or makes you by doing it creates a greater sense of peace, we can get all the benefits from there. So there's so many different aspects of yoga that can help us with pain. But as I said, I think there would be, and I can't think of many of them off the top of my head, but I know there's got to be some things where the pain is not going to be better from the yoga posture. Just one other thing to mention on this is there are very specific illnesses or diseases or injuries to the body where there will be yoga postures where you absolutely would not want to do that. So say you had rheumatoid arthritis that had extended, it had been there long enough and it had actually changed your neck and created instability in your neck. There's a whole bunch of neck movements that you would not want to do. Or if you had osteoporosis that was quite advanced, there's a whole lot of yoga postures that do not make sense in the face of those kinds of injuries. And that's where so many of us will need some guidance. And I hope that you'll be able to find guidance from someone who both understands the health side of your condition and someone who understands yoga, because there's so many different kinds of yoga. And just actually yesterday I met someone who's just finishing up surgery and chemotherapy after cancer, and she was saying that she had been recommended by a healthcare professional not to do yoga, and she realized that the person saying that didn't really know yoga all that much. and didn't realize that you can modify things as much. She's done yoga before, so she knows that. So hence coming back to me and figuring out how we can do it without, with taking care of the medical issue, as well as getting her back to doing something she likes. The next question is, can one use these guidelines for pain in the knee? Absolutely. You can use these guidelines, the guidelines of is this really dangerous, will I pay for it later, and monitor your breath and your body tension and the pain. You can use these guidelines for any condition whatsoever. Pain in the knee could be from so many different things. It could be osteoarthritis, it could be from a torn meniscus or injured ligaments, or so many different things. But regardless of the condition, if you follow these guidelines, you're more likely to be able to do the yoga postures in a way that won't kick up the pain, and if you're able to persist with them, that won't worsen it. And definitely around the knee, you need to be careful in a lot of the yoga, the more general yoga classes, because you can put a lot of force on your knee with some of the squatting or the kneeling down. Can put a lot of force on your knee that we need to take care of. So the next question is this dangerous? Will I pay for it later? How can you really know in advance? This is a great question, one that we get a lot. So for example here, when I do twists and side bends, I can feel a sequential clicking down my spine. How do I know this is okay for my experience, or is this where I need the one-on-one with a practitioner? Now, it might be a place where you need the one-on-one with a practitioner. You can imagine it's so hard to know from here. However, what I would say is that the first thing is you ask, how can you really know this in advance? So I believe that it's almost impossible for most of us to know this with pure clarity in advance. That's where the expertise of a health professional can help. But what we're looking for is that if you're going to be doing these gentle movements, the first thing we want is that someone with some expertise has said to you, it actually is safe. You're not going to injure your back. Your back's not going to be damaged if you're doing these movements. So then the next step is, after you've heard that, the next step is to ask yourself the question, and you may say, well, actually, I don't feel like it's safe to really push this. You may say, I don't know if I'm going to pay for it later. And so this, once again, would be the time where what we'd ask you to do is start by finding that calm breath, finding the best calm bar you can, and then move towards the position or do the movement really gently. And as soon as you feel an increase in the pain, then just come on back out of it. Just go over there and try it a few times really gently, and you just have to continue to evaluate yourself. It's the only way to know for certain. If I've had a disc injury in my back and I've been told it's okay to forward bend, how would I know how far to go, how many to do? Is it really safe? Because here we have this expert saying it is, and how do we know for sure? Well, we don't. What we know is we want you to try to move into it gently, to do your best to keep your breath and your body calm, and really to go with the there is no way to know, but given that you're paying attention to pain, to your breath, and your body tension, now you've actually got 3 alarm systems to pay attention to rather than just one. So you've given by paying attention to these things, you're actually giving your body sort of triple alarm, so that it can tell you in a whole bunch of different ways to back off, and typically it does. We often wonder whether, as we're becoming more tolerant of the pain, whether our nervous system is as well, and typically it's not. What happens with ongoing pain is your pain system actually becomes wound up and more cranky, so it's going to tend to tell you to back off way before you could cause damage to your back. And if you go back and you watch the intro to this last session, there's me trying to explain that there, how when you have pain that persists, the alarms are going to go off further away from where you damaged your body now. And so if you're just going up to that spot where the alarm is going off a little bit more, then you can be pretty much assured that you are safe. Now, the person here has mentioned about sequential clicking down the spine, and sometimes this is something that you would want to take some care of and get some professional input on. A lot of times this clicking stuff that happens around our spine, we just don't know for certain. And I know that a number of my patients have said that after a disc injury, they've sort of got this spot in their back that if they move a certain way, they get this really good click. And it just seems to be something that happens. We don't know. And by the way, the clicking I'm just mentioning is not just stuff that the person can feel inside their body, but sometimes if someone's standing beside them, the person beside them can actually hear it. So it's a fairly significant click that can happen, and we think that most of those are not dangerous. But you need that expertise to help you out with that. So the next question is a little bit similar to this. It's I'm nervous about lifting my neck to look up at the ceiling during the sitting cat-cow movement. I have disc deterioration and I've been told by some physiotherapists not to extend the neck this way. Am I limiting myself by doing it, or is it sensible to avoid this motion in my case? I realize that you may not be able to comment given this limited information. Well, I can't tell you exactly what to do, but I definitely can comment about it. The first thing I would say is that if your physiotherapist has told you that it's dangerous for you to look up, then that's probably true. What I would ask you to do is when you're talking to your physiotherapist is to say, so is there a distance of, in terms of look up? So should I look up? Should I not lift my chin up at all, or should I just be careful at not putting it up past a certain point? Because that's the thing that we need to understand is how far is it okay? Now, if the physiotherapist, whoever's working with you, can't tell you that for certain, then you can go back and try these guidelines. However, if your healthcare professional has said to you, you have this particular problem in your neck and it would be dangerous for you to look up, to take your neck into a upward or back bending movement, then I would suggest you really pay attention to that, because this is one area of the spine with some injuries that you could cause fairly significant injury to this little artery that goes up through your spine. So you need to take care of it. So it's an odd, this thing about putting our neck up and looking up is odd, because there are certain cases where you do not want to push neck extension or neck back bending, and in other cases where it's okay. If the person writing this, or if you're listening to this and you're saying, well, I've had an X-ray or something and it said that I've got some deterioration or degeneration of the discs in my spine, if this is the standard wear and tear stuff that happens in our neck, the likelihood of there being a significant risk from looking up is low. But if it's substantial changes in your discs where your neck has actually changed in terms of stability, then it's something you really need to take more care of. So all that said, people may be going, well, I don't know what to do. So what I would suggest to you is this, is give it a try, but only do it a very, very small amount. It's a little bit like doing circles with your neck. What often people do to feel safe and to know they're okay is they roll their head forward and take it up to their shoulder, and then from one shoulder they just sort of side bend all the way over to the other shoulder, and they do their neck circles with sort of a flat bit at the back of the circle. And people will do that sort of thing, and if they feel safe doing it, then they might try to do a little bit of a back bend. And that's probably what we want to try to do, is just try a little bit. If you are concerned, though, have a talk with your healthcare professional. And I'm sorry that's not perfectly clear, black and white, but it's not an area where we can give you that. And it's an area where there can be a significant risk. Anyways, we'll go on to the next one here. Is there somewhere I would have access to similar lower body movements? I would like to go further with this. So this is one of the things we've been considering. We just gave you some very gentle neck, shoulder, upper body movements with the webinar video that we did. Right now we don't have anything that's easily accessible. This is also one of the things where you could turn to some of the gentle yoga and Tai Chi DVDs that are out there to try to get some movements through there. Or if you do have back or hip issues and you want to get to the lower body, I think you'd be able to find some of the yoga DVDs that are yoga for low back pain or yoga for hip issues, and these would would be doing movements of those areas of the body, sometimes in sitting, sometimes in laying, sometimes in standing, and then you could try to use these guidelines and the ones that, start with the ones that feel safe when you look at them. But other than that, so we don't have anything else yet. So let's take another pause here, see if there's any other questions.
Two things. First, pat on the back. Diana says, "Thank you, Neil. I absolutely love your meditation and gentle yoga DVD that I got from your website." So just passing that on.
Okay.
And then a question from Mara. "How do I find someone who can tell me what's safe?" And the context is that she has a cyst in her spinal cord. So how can I find someone who can tell me what's safe?
Wow. I'm guessing if you have a cyst in your spinal cord, then some medical doctor has done an evaluation. So there's been either an MRI or a CT scan or a X-ray. Probably not so much an X-ray. You might be able to see it in the other ones. So that would be the first place to go, is to go to the doctor who was looking at those investigations and gave you the information. If the doctor is not certain in terms of what's safe in terms of movement for your back, I think that's where you really want to go out and find a physical therapist, because that tends to be, that's where the movement specialists. That's, we understand medical conditions and we understand how to get people moving. And maybe what you end up having to do is to get the physical therapist and the doctor to talk together, and the two of them together can come up with the answer of what's safe. That would be my suggestion of go that way. Did you get any other questions?
One sort of from a back category, someone saying, "I fall asleep after trying any yoga on deep breathing. Is there a way to prevent this, or must I just plan to nap?"
Okay. Well, there's so many different things about this. And sorry, I'm not laughing at the problem. I'm laughing at it's so common. When the pain is really bad, we end up being sleep deprived, and then we do anything that tries to take us towards relaxation during the day, and we're snoring in no time at all. But at the same time, we're having a hard time sleeping at night. So if that happens, the first thing I would want you to do is get that alarm clock beside you to, if you think I'm going to try practicing this for 10 minutes or 15, whatever it is, get the alarm clock beside you so that you do not continue to sleep, because if you start to nap too much in the day, you're going to disrupt your nighttime sleep even more, and you don't want to do that. A lot of people, when they're starting to do any practices, whether they have pain or not, when we start to do relaxation practices, we tend to fall asleep, because that's what we've been doing all our life. The one time we sort of practice relaxing is on the way to sleep, and so now you're trying to relax and to find a way to be awake, and so it's really common for this to happen, that falling asleep. So what do? You get that alarm beside you, and that'll help. The second thing you'd want to do is, when you get into doing this at first, what you want to do is actually have a little conversation with yourself that pretty much goes that my intention is to stay awake. So you're going to tell yourself, right, that the whole point of doing this is to stay awake, and I'm going to do my very best to do it. Then you try to sort of hold on to that, go into the practice, and you'll probably find that the first number of times you're going to fall asleep anyway. But if every time you do it, you say, my intention is to stay awake. As long as you're not wildly sleep deprived, you should be able to get to the spot where you can learn how to stay awake while you're doing this. It is a learning thing. Now, if all that's not doing well, then what we need to do is we need to find a relaxation or meditation technique that engages your brain enough that even though your body is starting to calm down, your brain is actually alert. And this is where sometimes some of the biofeedback techniques can work, where you're looking at something on the screen and you're trying to control things on the screen. That at the same time as your body is calming down, while you're doing this, your mind is engaged in this thing that you're doing, and so you can stay awake better. And that might be what you'd want to look for. There aren't that many biofeedback things out there right now. Most of them are fairly expensive. There are some that you can get for like $299, which is still pretty expensive. But I can't think of any other ways to do that other than, I guess the last thing I would say is, once again, find someone who's experienced in helping people learn how to relax, and get them to do some work with you one-on-one and see if they can help find the answer for you.
I think that's most of the questions for this category.
Okay. All right, so bit of a safety question here. The instructions Neil gives are applicable to a pain situation in which there is or has been tissue damage, and pain may be increased by certain movements. I have chronic headache, and while I have tense, sore neck, shoulder, and upper back muscles, I don't think my condition was caused by tissue damage, and I don't really see a direct relationship between movement and my level of pain. I'm not sure how the instruction and explanation would apply in a case like mine. Can Neil comment on this? I think this is exactly right, is that there are differences that we need to look at in terms of pain. So there are some pain conditions that are caused by injury to the body, and there are some pain conditions that are caused by diseases that affect the physical body. And then there are other pain conditions that can come on from problems in other systems. So the headaches this person has, it could be a problem, say with the vascular system, like migraines, or it's possible that headaches sometimes can be due to shifts in other chemistry in our body, hormone, immune system. We don't really seem to understand fully about chronic headaches. That said, though, I've been surprised that sometimes when I'm educating people about this in big groups, that people will show up who have headaches, chronic headaches, or migraines. And I've heard this message a number of times from people, is that they're desperate to try something, so they go home and they try this calming their breath and calming their body, and then starting to do those things while they're trying to move. And there's been people who have come back and said, if I can do these sorts of things when the pain is just starting to build up, I can often prevent it from getting really bad. If the pain is really bad, these techniques don't work as well. And people have told me that they don't find that they stop the pain at all times. What they can do is prevent it from getting worse. And I don't have a real good answer for this. I can tell you that there are other things that are similar to this. There are people who have irritable bowel syndrome, and there's been some research that shows that when you get people who have irritable bowel syndrome, which you can imagine is really, it's a little bit like having a really cranky stomach and intestine, where the food that we eat that's in all of us would upset us to a certain extent. It takes very little of anything spicy or different, or too heavy or too fat or too much protein, and this person starts to have this really quite horrible pain and bloating through the bowel. So we've got this problem that's not specifically an injury to the body, and it's not specifically to the muscles and skeleton, but there's some really great research to show that when people work on breathing and relaxation, and when people do yoga practices, that they find that their irritable bowel syndrome gets better. Now, one thing that we don't know is that it's possible that when people are starting to do the meditation and yoga, when they have things like irritable bowel syndrome, they might be also saying, okay, I'm going to start to do something more healthy in terms of meditation and yoga, but what they might also be doing is changing their diet as well. So we don't know for certain that isn't part of the reason why they feel better, but we know when people start to do this that there are benefits that happen in pain conditions that aren't specifically related to tissue disease or to injury. So the short answer would be, if you have pain that's not from an injury or tissue disease, give it a try anyway, see how it goes, because the research is suggesting that there are people who get significant benefit from this. For the person who wrote this, if you have a headache and then it makes all the muscles through your shoulders and neck and upper back get really tight and tense, it's possible that that tension will then feed back into the pain of the headache, and then actually you get a vicious cycle. So hopefully these sorts of practices, even though they might not change the sort of original headache, what they can do is take out some of the escalation of the pain that's happening when your body gets really, really tense. And I'm sure when your body gets tense, your fight systems gets even more agitated. So it can sort of help on the sort of secondary effects of the headache. Anyway, I hope that's helped out with that. So a couple other things that we've got here. One person says, my knees are hurting really badly when I'm in the kneeling position. Can I do it in another position instead? Absolutely. What we want to do is for every physical condition, try to modify the position. And definitely if you have knee issues, then you probably want to avoid kneeling. For some sort of anatomical quirk, I don't have any problems kneeling on my knees, even on hard surfaces, my knees are okay. But a lot of us, because of our anatomy, regardless of whether there's something wrong inside the knee, kneeling down is just a difficult place to be. And obviously, if you're kneeling and your knees are hurting, it's going to be really, really hard for you to keep your mind focused on what you're trying to gain here. So you don't want to start there. So you could do some of the positions, some of the same movements of your body in sitting and laying down, and you need to. If you can't figure that out, then I think I can guarantee you that pretty much any yoga teacher around will be able to give you a lot of different modifications that you can do so that doesn't happen. The other point related here says, can going to the edge worsen degenerative processes, say in the knees? So my belief is that if you are mindful and if you're going to the spot where the pain is just a little bit more, right? You're going to that spot where the pain is just a little bit louder, right? The alarm's just a little bit louder, and you're able to keep your breath and your body calm. I don't believe that you're going to worsen a degenerative process, because I don't think you're going to be able to get to the spot where you're putting enough force on the tissue to cause more degeneration. And our hope is that by doing the movements at that place that's further away from where you would cause tissue harm, that the tissue will actually, even in the face of degenerative changes, that there will actually be changes in the tissues of your body that would allow you to be able to then be better, even in the face of degenerative changes. So can going to the edge worsen degenerative processes? Not usually. I think the time that it does it, if you go on the flip side, when can that happen? It happens when we take the tactic of gritting our teeth, just holding our breath and pushing through the pain. That's when we need to be worried about these things. And by the way, if your degenerative process happened to be something like rheumatoid arthritis, what we'd want to do is make sure that when you are in a flare-up, your edge is going to be totally different than when you're not in a flare-up. When you're in a flare-up, you have to be so careful about how you're moving. But if you're not in a flare-up, and if the joints that you're working around aren't in a big, haven't become really unstable due to the degeneration that's happening along with the rheumatoid arthritis, then you're okay to go to this edge still. And we want you to. We want you to don't just be guided by the pain in that case, because the pain's not giving you accurate enough information. It's going to tell you to stop really quite soon. So that's why we want to work with this, the edge of where you can breathe, where you can keep your body calm, and where the pain stays low. And definitely, if you have something like rheumatoid arthritis, it's really, really valuable to talk to your healthcare professional. In this case, probably your physical therapist or occupational therapist, about when you're not in a flare-up, how hard should you be pushing these joints, or how gentle should you be? Because we often tend to back off more than that's best in terms of trying to make some regain some things when we're not in a flare-up. But talk to your healthcare professional about that if you have RA, because it's important. So let's go back to the audience. Any further things?
I'm just going to pass on a little more praise, because I think it might be useful to others. Ron says, as a result of these webinar videos, I am now able to resolve pain causing tension, not only during home practice sessions, but also during my daily walk. I am now able to actually feel tension developing in my hips during a walk, and can go to a place in my mind that helps dissipate this tension. The result is less pain and potential damage in this area. I thank you, Neil, for this.
Wow. Thank you for saying that, Ron. That's that's fantastic. I mean, when it works like this, I think, or I hope what it does is actually gets people to realize that there is hope. It doesn't always happen as fast as it's happened with you. And often when people say things like this to me, it's when I start talking to them, it turns out that they've been working on some wise things before this. So you sort of prepared yourself for this kind of thing. But it definitely shows that it's possible. Even in the face of big, long-lasting pain, there's still a chance we can change it. So thanks for sharing that, Ron.
I think that's most of the questions. We've got one section left. Am I right?
I am out of comments and questions from my end. And we have about 10 minutes left. So maybe we'll pop it back to the people who are on. If there are any other questions or comments you want to toss in, please do that.
Okay. Hang on a minute here.
Hey Lisa, I think you might be muted. I can hear you in the other room, but I can't hear you.
I sometimes hear about a 2-hour rule, that if pain is worse 2 hours after exercising, then I should cut back. Would you agree with this?
Oh, great point. And if I just were to, if you only give me the option of saying yes or no, I would say I do not agree with that. However, it may actually be exactly the right rule for an individual. So what we want to do is the very first thing is look at, if we're going to start to try to move more, try to exercise more, to recover more function and ease of movement, what we want is that after we do the exercise, activity, or movement, that we're feeling like the benefits of what we have just done outweigh the consequences. So if someone were to say to me that their pain is worse for 2 hours afterwards, I would say, well, do you think that's okay? Do you think that the benefit you're getting from doing the activity outweighs the fact that you've now had 2 hours of increased pain? And some people will say, absolutely, it's okay. If I do it and the pain only stays bad for 2 hours, that's fantastic, and I know that this is going to be good for me in the end. Whereas other people will say, no, I'm not prepared to have that increase in pain yet, or the increase in pain is it's worse for 2 hours, but then it sort of lingers and I stay sort of agitated afterwards. So I think we want to try to, as best we can, stay away from guidelines that are like that, and try to think of them in sort of a bigger sense of what are we trying to do here. It's a little bit like sometimes people say that when you're doing exercise, if you rate your pain on a 0 to 10 scale, that while you're doing your exercise, the pain shouldn't get more than 2 points more intense while you're doing the exercise. Now there's some wisdom to this. This is people saying, okay, well, you don't want the pain to get, it's okay to have some increased pain, but we don't want the pain to get too high. But the problem is it's individual. As some people may, if my pain is say an 8 or a 10, and it's going up to a 10, that's probably not acceptable. If the pain is a 5 going up to a 7, it might be more acceptable. If the pain's a 1 going up to a 3, I'm probably saying, well, that's perfectly fine. And so, because these scales are so individual, we want to look at these guidelines and then try to make them have the most sense to where we are and what we're doing. So, if your pain's worse for more than 2 hours, or for 2 hours afterwards, ask yourself, do I think that I'm still getting benefit from this? And if you are, and you're not making the pain scream all the time when you're doing the activity, then I'd say this is probably okay.
Okay, there are a few more questions now. One of them is about safety and a specific pose. She says, every time I do child's pose, curling my back to reach forward, I'm strained for 3 to 4 days in my lower back. It gets difficult to roll over, etc. This has happened 3 times, even though I'm being very careful and not straining or reaching for too long. Any suggestions? From Catherine.
Oh yeah, Catherine, this is great. So my very first suggestion would be don't go as far into that posture. It'd probably be the easiest thing to do. It might be the length of time that you're in the posture that's the trouble, but what I would do first off is see if I could put something under where my head is going to go, or even stack my hands. Sometimes people put their hands in sort of gentle fists, one on top of the other, and then put their forehead on top of the top of the two hands so that you're not sinking down as far, or putting cushions, pillows, blankets, something underneath your shoulders and chest when you come down so you don't go as deep into the posture. As much as it's important to modify the position, the other thing that you can do is go back and see when you're in the posture, what's happening in the other aspects of you. So are you keeping your breath calm while you're there? Because that might be part of the problem. Say your back's feeling strained, that may be going on. It's possible that while you're there, because it's always hurt before, that your mind's in this, oh, this is a bad idea, I shouldn't be here, every time I do this it's going to make my pain worse. And if that's happening, what we need to do is try to find a way to make that less, because that all by itself could really, really crank up an already cranky nervous system. So the problem's from your back, but if your systems have learned this is a bad idea, they may sort of turn on all the protection while you're there. So you'd want to either find a way to calm those thoughts down, or what you do is you position yourself in a place where those thoughts are common. Some people will say, I'm in a place, the pain doesn't feel too bad, I can keep my breath calm and I keep my body calm, and yet the pain still gets worse. Sometimes it's because of the agitation that can happen from the mental processes, right? Which is really brain activity. If the brain is really getting agitated and the fight-flight system in your body is getting agitated, even though you're trying to calm things down, that could lead you to be worse. So modify the position a bit. Check to see if you can still breathe calmly. Check to see if you can keep your body tension low. But also make sure you check to see that your thoughts and your emotions are in a more calm state. And if they're not, just keep on backing out of that posture to a spot where you can feel that, and then go from there.
Now there's quite a few questions about yoga and safety. This one might apply to more people. Is there any way I could do the exercises? Because of back pain, I cannot do them sitting down. Any alternative? Can I do them laying down? I have been on bed rest for 3 years and have not done any activities, let alone exercise.
So if you've been on bed rest for 3 years, then I think this is where you need someone to come in and actually give you the guidance in terms of how you move. So get you to move, get someone to watch you while you're doing it. They can give you the feedback of how you're breathing and such. Unfortunately, that's going to have some expense, and hopefully you can get that. That would be the best way. If you have been on bed rest for 3 years and you want to start moving at this, I would suggest that what you do is start with visualization or imagery. So rather than starting to do a lot of movements by moving your body around, what I would do is get you to watch a yoga DVD and see what they're doing, and then close your eyes and imagine yourself trying to do that sort of a movement. Maybe you can't fully imagine it, but try to imagine yourself doing some of those movements, because when you do that, you're going to engage your nervous system, and so you're going to sort of prep your nervous system to be ready. Whereas if after 3 years of being in bed, your nervous system is going to probably be on a bit of a vigilant state, and your body is going to not be all that tolerant of movement yet. So if you can prep your nervous system first and then move into start doing some gentle movements, and certainly you can do modify the movements for laying down. We need to find videos or things that you can watch to provide that. But it's the beauty of yoga is that you can modify it so that you can do it from a wheelchair, you can do it from laying down, you can do it from standing. We just have to figure out how to individualize it for you.
This one's sort of about a specific posture requests. She says, I have shooting pain traveling on the outside of both legs from the feet up to the hips, have trouble walking. Is there a yoga position, do you think, that will help this? From Pearl.
Oh gosh, Pearl, I wish I could. This is one of the questions that I know I can't really help all that well. And what we really need to be able to do is know what the diagnosis is, or be able to work with you one-on-one to be able to see, because there's so many reasons. That pain in your leg, the shooting stuff, I don't know whether it would be from your back or from your feet. So I apologize. I really am not sure how to give you any good guidance other than see if you can find a healthcare professional who can guide you on that.
From Debbie, do you have any thoughts on carpal tunnel syndrome and yoga?
I got lots of thoughts on that. There's actually been some research showing that when people with carpal tunnel syndrome start to do it, that they get better. Now they're going to have to change what you're doing, because you don't want to, if you're yoga and you know about sun salutations, that's not where you want to go right off the bat when you have carpal tunnel syndrome. So you wouldn't want to jump right into the postures that require you to be, say, on your hands and knees with your wrists really pulled back, or even downward-facing dog in the face of carpal tunnel syndrome may not be the place where you start. There are some resources out there. If I remember correctly, there's a woman who's a really excellent yoga therapist person in New York City. Her name is escaping me, so I'll talk to Tanya afterwards and get it on the website, because she's developed some yoga DVDs and explanations specifically for people with carpal tunnel syndrome, because she was in the area she was working. There were so many people who were developing it. So she developed a series of yoga postures that go from sort of gentle wrist movements and breathing and relaxation, because that's key with carpal tunnel syndrome, is to figure out how can you get the muscles in your forearms to stop being so tense, and how can you get more relaxation in there as well. Anyway, I'll find her name and get Tanya to post that, because there's definitely yoga for carpal tunnel syndrome information and guidance out there.
What are your thoughts on taking pain medications so that you can start to participate in yoga?
Okay, so being a physical therapist, I have limited capacity with medication question. However, what I would say is, if you're taking pain medication, it would be the wisest thing for you to do is to talk to your doctor or physical therapist or someone about this, so that they can, because different pain medications are going to do different things. Some of them make you feel dopey, and so you're a bit of a risk when you're trying to do things. However, anything whatsoever that takes pain from a severe, a sort of moderate to severe pain level, that then allows you to be able to be more active, is fantastic. And I know there are very there are varied situations around this, but it's sort of a key component of good pain care from the healthcare professional system. Is we want to try to find things that get your pain down to a low enough level that you can do the things that you need to do to get better, and that's an excellent way to use medications. If they get you to the spot where you can move, then that's exactly how we want them to work. Much better than you could take the pain medication and it gives you a sense of peace and relief, and if you just lay there, well, nothing's changing down the road. Whereas if the pain can come down lower and then you can be more active in a safe manner, it's the perfect thing to do. Definitely talk to your healthcare people about it for your individual decision on this.
Okay, I think we're going to have to actually stop there. We're right at noon. So I'm glad everyone was able to join us. Neil, thank you very much for your answers and for your insight. It was a very wonderful session. I think we had some very good questions related to this practice.